Hey everybody, let's talk a little bit more about the standard protocol or approach to undertaking a Lyftogt Prolotherapy injection session. Initially, what we're going to do is mark these Valix points. Now, Valix points are areas where nerves bifurcate, cut in two, go under, through or over a muscular junction, or are areas of hypersensitivity. That may mean that they're the area of entrapment there. Now, these are found through very soft touch, similar to a light to Nels percussion or a little bit of a palpation of the skin. We're not doing hard, we're just doing a very soft feel of that tissue because we're looking for that neurogenic inflammation or that nerve inflammation and localized sensitivity. Now, we have great diagrams that help guide us to each of these points when we're first starting out, but typically you get a really good feel through the more injections that you're going to be doing. Now, the main aim is to identify these stress tissues, and then we're wanting to look at 3 levels above or more proximal to that area, which are areas of bifurcation or entrapment along the same neural pathway as the initial area that you're looking at, because that's the area that's been innervated by these more proximal or further up Valix points as well. And the idea is we do want to go 3 levels above where our potential pain's been experienced. Now, after we've marked all those Valix points, we then want to prepare for our injection. And injections don't come with no risk, and the main risk that we're looking at here is infection. Now, typically I'll wipe over with an alcohol wipe, but when I'm doing larger areas, I'll then use maybe a chlorhexidine, but generally though I'll use alcohol wipes. Either way, wait for the fluid to dry off before starting your injection. Now, what we're looking at here is we're going to start our injections. Now you can see that there's a really nice wheal or a little bit of skin that's elevated off around the other area. Because what we're doing is we're injecting 0.5 ml of the 5% dextrose with saline to all the pre-marked points, and we're starting from the lowest down or the most distal and coming up proximal. Now, what we're going to do is we're going to repeat that up to 3 times. Now, we don't just go 1, 2, 3 and that's it. We're going to double check and see what we're looking at there. See how you have responded or the patient has responded. And to do that, we're going to wait 3 to 5 minutes and then lightly palpate or press on each of those Valix points again in a similar fashion to what we did initially. And if there's no pain there, then we rub that off. Typically, patients will explain that they've had an anesthetic-like response. It's gone numb in that area. And that's telling us that that Valix point has been activated and is no longer a concern. Now, if it is still a little bit tender and it may only be reduced rather than as strong as what it was previously, all we want to do is leave that in there. And like I said, we might inject that up to 3 times in total. And if you've already done your 1, that might be a 2nd and then a 3rd time. And that's what we're looking at there. At the end, go over again with your alcohol wipe just to make sure everything's nice and clean. There's very minimal bleeding that happens here. It's a 30 gauge needle. It's the size of what we're looking at for a vaccine, and so very small, less likely to cause any significant bleeding. But what I like to do is I like to tape, and I'll typically put the patient's foot into a stirrup taping type technique. Sometimes if it's say an Achilles tendon, I'll bring that right up to the calf as well along that central midline there. I find that it's a really incredible option because it really helps with proprioception, giving that feedback as if you've got a really nice big ligament helping to support your whole foot. And for me, Hyperfix is king because it's got enough stretch to activate those mechanoreceptors and really give that result there. Now, typically what I see is most of my patients, and I'm probably saying over 70%, would have up to a 90% reduction in pain by the time they walk out after that session. To me, that's perfect and exactly what we're both looking at, being me as the practitioner and the patient coming through for that outcome. But hopefully this has given you more information on that standard protocol of Lyftogt Prolotherapy. Keep watching for more information. Cheers.